Okay, put up 5 fingers. So put a finger down if you've ever gone to work in a hospital or a clinic while you've actively been sick. Put a finger down if you've been terrified to call in sick because of management or retaliation or mandatory attendance points. Put a finger down if you've had approved paid sick time off denied because of operational needs or staffing shortages. Put a finger down if you've been guilt tripped by a supervisor who said if you don't come in, you're abandoning your team. And put a finger down if you've had 0 paid sick days, meaning that if you don't work through the pain, you don't get to pay rent. If you even have 1 finger down, then you already exactly know why the nursing community is in a state of absolute fury and grief right now over the death of Jakoya Renae Morgan. Jakoya was only 19 years old. She was a certified nursing assistant. And on May 26, 2026, she was working an overnight shift at the Children's of Alabama's Birmingham Hospital when she suffered an acute medical event, collapsed, and then died an hour later. While the official investigation into the exact medical cause of death is still pending, her death ignited a wildfire across the nursing healthcare community, and we need to talk about what it means to be sick at work and calling in sick and feeling supported when we do. My heart goes out to the family because this tragedy really has hit a massive nerve because it exposed the hypocrisy of healthcare culture. We work in institutions whose entire multi-billion-dollar mission is healing, yet the internal culture treats the actual providers as unbreakable. Study after study by organizations like the ANA and the CDC show that healthcare worker burnout is at an all-time high, with over 60% of frontline staff reporting severe chronic exhaustion. We've all done it before. Worked through high fevers, chronic illness flares, and even severe mental distress just to keep the floor running. But this is the problem. We don't take care of ourselves, and there is no blame on her fault. The blame should completely rest on the shoulders of the institution and the culture of healthcare and nursing that continues to have this type of behavior thrive. When a system relies on staff setting themselves on fire to keep the hospital warm, that system is completely broken. So when policies are structured so that a 19-year-old or a seasoned RN is too afraid or too guilted or too financially unstable to say, I'm not well enough to stand, we are no longer practicing healthcare. We are running an assembly line that consumes its own workers, and that's how it's been for a very long time. We cannot talk about patient safety without discussing staff safety. An exhausted, sick, and compromised healthcare provider cannot provide safe care. It's a danger to patients, as we've tragically seen, and it's a danger to the staff. And we need to end attendance retaliation. There are no perks to this system. Again, rest in peace, Jakoya. It should have never happened to you. Watching, how many fingers did you put down? I think we need to expose how deep this goes into the comments. Let's talk about how we can change this.